Hi, it's Dr. Denney over at Four Paws at Fulshear Veterinary Clinic, and today Maddie and I are going to be discussing a little bit more about dog dental disease. So we're going to start off with some frequently asked questions. Hopefully this helps answer any questions that you might have and maybe even some questions that you might not have thought to ask.
Dr. Denney, what is a veterinarian looking for during a dog dental exam?
So when we're doing an oral exam, and if I'm doing this on a patient that's there for, here for an appointment and I'm doing a physical exam, I'm looking at, are the gums nice and pink? Are they nice and slimy and hydrated, or are they sticky, tacky, and dry, indicating dehydration? I'm looking to see if the gum is darker red or purple around where it meets the tooth, indicating that maybe we have some gingivitis, just like in humans. I'm looking to see if there's any obvious sign of disease, like a fractured tooth, a missing tooth, an oral mass. I'm looking to see if there's tartar on the teeth, or calcified tartar. So that's where your plaque has been there for so long that it becomes calcified. That's what we actually have to kind of scale and crack off the tooth. That's a big part of why we require anesthesia with our dentals. It's not a comfortable thing. So they, when they're asleep, they don't feel it, which is great. But we're assessing the level of tartar. There's 4 grades of dentals, grade 1, 2, 3, 4. 1 is just basically a simple cleaning, just a little bit of buildup. 4, we have a lot of really diseased teeth, infected teeth that have to be extracted or removed. So there's a lot that we can find out about the patient during an oral exam.
Why does a dog need dental radiographs?
So dental radiographs, in my opinion, is standard of care. And there's a bunch of reasons why. So if you think about it, in dogs, we're really only seeing just the top of the tooth. You don't see the root. So if we take a canine tooth, for instance, what you see may be like about this much, but the root might be this big, okay, or even bigger in a bigger dog. And so that is all that tissue underneath the gum line that we can't see with the naked eye. Dental x-rays are helping us assess the health of the root, the health of the pulp cavity. It's helping us assess the periodontal ligament, which is what goes around the tooth and helps hold it in place. So dental x-rays are going to help us to see, is there a tooth root abscess? Is there infection? Is the bone being eaten away by an infected tooth? We can assess all this on dental x-rays. That's also how I make the decision on, hey, does this tooth need to be removed or not? If you've been here and you've met me and I've done a dental on your pet, you will probably have heard me say I'm not a big fan of pulling teeth. I don't like removing teeth. It's not fun for me, but it is very necessary when they get infected. But if the roots are healthy and there's medical treatments that we can do to try to save the teeth, I typically will try to save the teeth. We only remove teeth that are absolutely necessary to be removed.
Are issues addressed during a dog's initial oral exam, or are follow-up appointments necessary?
So on an oral exam, like if we're getting a physical exam and we're in an exam room, this is when I might find problems. So it's going to depend on what we find. If I see that, hey, we have a tooth that's fractured and right underneath the eye, there's a swelling because there's a big major molar that's right here, and the roots go right up here, right below the eyeball. So if there's a swelling and it's ruptured and there's yuckiness oozing out, then I'm gonna be like, oh, that looks like it's probably a tooth root abscess. And so that day, your pet will go on anti-inflammatories and antibiotics, and then we will get a dental procedure scheduled. So if it's something like that, there will be treatments that are done that day, but most will be done later, and we'll actually get a scheduled appointment for a dental surgery. All right, guys, I hope this helped answer some of your questions that you might have. If you think your dog has dental disease, please feel free to give us a call and get an appointment. Thank you.